It's a beautiful day in the neighborhood, a beautiful day to ask a gay doc. With Dr. Renzo Corzano of Desert Oasis Healthcare. Hey, Doc Renz, how are you?
I'm good, man. How are you?
I'm fine. Today we're going to be discussing natural male enhancements, those over-the-counter supplements that promise stronger erections. Dr. Corzano is going to be sharing his expert insights and guidance, helping to separate fact from fiction regarding these supplements known officially in the medical community as...
Boner pills?
Yes. you know, we try and do this in a lighthearted way, but we preface this by saying erectile dysfunction is a real thing.
It is, yes. There's a lot of stuff that can happen because of that people are resorting to these supplements that can be very harmful. So we kind of gotta, dive into that.
All right, but before we do, we have to say some of the names. Rhino, Python, Big Daddy, Steel Erection. Now they got gummy worms called woody worms. And there's a product out there called Hard Wang.
There's an herb called horny goat weed.
Yes, I've heard of horny goat weed.
Yeah, I was like, wow, that's crazy.
It does have some effect on erectile dysfunction, but the problem is you make this sound during sex. It's not good. Enough dad jokes. Let's get into it.
Okay.
We see these products for sale all over the place. They make these promises.
Yes.
And do any of them help?
Most of them have not been studied like scientifically. Okay. And then I found this really interesting. They think that it's likely a placebo effect. When they did trials between Viagra and placebo, they actually saw about 30% response in the placebo group. And so maybe it's, a placebo effect going on. The problem with these is that they may not be safe. They may cause allergic reactions, or they can interact with other medications that people are taking. That's kind of what the problem is. And, they may have some, impurities that may be harmful for people.
So they don't have to live up to the rigorous standards of big pharma, where they have to go through these trials. They cost millions of dollars to prove that Viagra or, any of the sildenafil variants work.
So by law, any dietary supplement or any kind of supplement in general, it must contain at least one vitamin, one mineral, one amino acid, an enzyme. But the rest, whatever else may be there, okay, those are things that may not be tested. And so that's kind of why it's a little bit harmful, right? Or it can be harmful.
I remember a few years ago, there was a blue pill and that was sold over the counter, and it worked. It really worked. But then they had to take it off the market because they found that it actually had Viagra in it.
Right. Isn't that crazy?
It is crazy because you're not getting a dosage that is, the 50 or the 100 that a doctor would prescribe. And some people had heart attacks.
Right. And that's actually something that I found with yohimbine, which is actually something that apparently can work. It comes from the bark of a tree in Africa. But the problem is, are you getting too much or too little? So it's kind of hard to really, dose it appropriately. And in fact, it may actually cause heart damage, and it can actually increase your blood pressure. So things like this come with potential side effects that could be pretty dangerous, right? The other thing that I was reading on is L-arginine, which is an amino acid. It can cause nitric acid, which can relax and open up the vessels, engorge the penis. But allegedly, putting this into a pill hasn't really been proven to produce an erection. And it's actually dangerous with people with heart issues. You don't know what you're putting in your body that may be interacting with other things that you might be taking, right?
I took one that had the L-arginine in it, and it caused the worst acid reflux for a whole weekend.
See?
And it was awful. You couldn't get a rollade the size of a birthday cake to make that acid stop. And so what would have been causing that?
I don't know, probably vasodilation of your esophagus sphincter. Yeah, just causing all that, acid to come back up.
Yeah. So they have effects, but they don't always have the effect that they advertise on their colorful little Big Daddy Steel Erection Woody Worms package.
You want to talk about what actually helps?
Yeah, tell me.
Yeah. Non-medical things could be lifestyle changes, like weight loss can actually, help smoking cessation and limiting alcohol intake. And if we, talk about medications, would be, Viagra, Cialis, or injectables like Bimix, Trimix, Quadmix, which I'm all for. I actually, do prescribe those things. But see, the real issue for me, John, honestly, it's like I feel like a lot of the times I don't think that patients really feel comfortable talking to their doctors about their sexual health. I've had patients that I've known for about 2 years here, and then they barely are bringing up things like, "Hey, I got to talk to you about something that's really personal." And I'm like, "Oh, I wonder what it is," right? And it's always like, well, not always, but most of the time, an erectile dysfunction problem. And people carry shame around that. It's like just society or whatever. But for me, it's about establishing this relationship with your patient so they feel safe enough to tell you these things so you can actually provide uh, proper care. And the other thing about erectile dysfunction is what's the cause. It could be vascular, right? Like severely uncontrolled diabetes can actually cause erectile issues, prior prostate surgery, cortisol imbalances, thyroid issues, even medications like anti-blood pressure medications can cause this. Antidepressants, illicit drug use, like, meth can actually cause erectile dysfunction problems. And, psychiatric issues, like maybe PTSD, like performance anxiety, regular run-of-the-mill depression can cause these issues too. So it's so multifactorial that, one supplement over the counter at the 7-Eleven, may cause more harm than can actually, do anything to help people.
And this is why we have these conversations so that maybe people can have the open dialogue with their doctor, not carry the baggage of shame. Because in this town, come on, what is the percentage of folks that are experiencing ED in this town?
It's high. Safe bet over 50%.
Now, don't you feel better? You're average if you have ED over the age of 40.
I would say, yeah. I mean, it happens with age. It's just something that happens, but it's treatable. Like so. I don't know. I'm all about promoting. Like open dialogue with patients. Like free of any kind of baggage, and yeah. So
yeah, we came here for the lack of shame, and we appreciate all of the information that you give us. Dr. Renzo Corzano of Desert Oasis Healthcare. You can send a confidential question to lgbtqhealth@mydohc.com. The bottom line is be careful because these things do have effects and they might affect your health in a negative way. Talk to your doctor honestly and openly.
Yes, please.
Hey, it's John Taylor. Thanks for watching our video. And don't forget to like and subscribe to our KGAY channel so you won't miss anything going on in the neighborhood. And you can always listen live to KGAYPalmSprings.com.